Hi everyone, this is Dr. Konstantin. I'm a facial plastic surgeon and, as you know, a facelift expert, and we are going to talk today about the difference between the procedure called FaceTite. And I ask this question a lot: what is it, how does it work, and how it compares to a facelift, and which one is better and which one would work for you, and how you decide which one you should go with. So we're going to talk about all the different aspects of those procedures, and we're going to compare one to the other one. So first things first, what is FaceTite? FaceTite is the combination procedure when liposuction and radiofrequency is used together. So radiofrequency helps to melt the fat, and liposuction will remove that melted fat from the area. And radiofrequency also is going to help to create some scar tissue in the area where it's used, and that scar tissue typically will help to tighten the skin, and it will prevent it from falling. So you get both of those effects with the FaceTite procedure: removal of the fullness and some tightening of the skin. Now with the facelift, it's based on a completely different principles. The incisions are made typically around the ears and the tissue is lifted. So liposuction could be a part of the facelift procedure, but with the facelift we are not relying on the skin tightening itself. We actually tightening the skin by lifting it up and removing the extra skin. Because the FaceTite procedure is done with just by liposuction and radiofrequency, and the skin is not removed, so obviously the incisions are going to be much smaller. Typically, it's a tiny incision right underneath the chin, and through that incision, the doctor can pass the cannula and treat the area of the lower face and the neck with liposuction and radiofrequency. With the facelift, on the other hand, since we do need to remove that extra skin, it's not going to tighten itself, we have to make the incisions that are going to be more extensive. One would typically hide under the chin if we do a neck tightening type of procedure, and then the incisions would hide around the ear. Recovery time between those two procedures differs significantly. With the FaceTite, it would be about 2-3 days typically, maybe slightly longer, until you are ready to face the public and go outside and start doing your normal things. With a facelift, it's about 1 to 2 weeks. So 2 to 3 days as opposed to 1 to 2 weeks, definitely much shorter recovery time. The cost of the procedure also differs significantly. So for a FaceTite, and the prices could vary, but it would typically be somewhere between $2,000 to maybe $5,000, maybe slightly more expensive. And for a facelift, like a mini facelift type, it would be about $15,000 to $50,000, right? So definitely significantly more expensive. So at this point, the question becomes, if we have one procedure that is done through a very small incision, it is much cheaper and its recovery is much quicker, and the other procedure that has big incisions and a lot more costly and have significantly more recovery. So why would anybody go for this big costly procedure? What's the point? Why not just do the FaceTite for all of us? Well, here's where we need to talk about the limitations of the FaceTite procedure. So one big limitation is that it works for people with the fullness under the chin, with the fuller faces. Obviously, those are the people that benefit the most from the liposuction. When somebody's face is fairly thin and they don't have that extra fat, obviously the FaceTite procedure would not be quite as beneficial for them. Number two is longevity of the procedure and longevity of the results. So with a FaceTite, the result is temporary. People who do FaceTite, they don't really do it instead of a facelift. They do it to postpone the facelift. So you can do a FaceTite now and maybe a facelift in 5 years, so it almost works as a bridge. Now, a facelift is a definitive procedure. So once you get the facelift done, you expect the results to last, good 10, 15 years or possibly quite longer. And the third reason why many people would prefer a facelift over a FaceTite procedure is the side effects. The side effects of the facelift are fairly easy to predict. And of course, there could be some surprises. Not everything is 100% guarantee in medicine or in surgery. But with the facelift, you kind of know what to expect. With a FaceTite procedure, you're really uncertain what kind of result you're going to get, and you're also uncertain of what kind of side effects you might get. Because with some people, it looks great, everything tightens up, and the fat is removed, and the face looks younger. With other people, they either would not get the sufficient results, or they would develop that scar tissue under the skin that would make the skin look uneven. And I've seen this a lot with radiofrequency energy devices. When people get the treatment works, it tightens everything up, but it looks very uneven, and it looks very noticeable that something was going on. And typically the same problem does not happen with a facelift when it's done by a facelift expert, of course. All those energy devices, all those rejuvenating cosmetic procedure that rely on using high energy, whether it's ultrasound or radiofrequency, they work for some people but not for others, and oftentimes it's very difficult to predict whether this kind of procedure would work for you. So some people may get FaceTite procedure and they will be thrilled with the result, it would look great, and others would do the same and would hardly have any results. So in summary, both FaceTite and facelift are great procedure when they're done for the right person at the right time. So FaceTite works very well for people who have some fullness under the chin, for example, then they want to get rid of it. They are not ready for something surgical, not ready for something bigger. And of course, they are concerned with that just straight liposuction is going to cause a lot of skin laxity, so they want to tighten the skin. And the facelift works the best for people who are ready for facial rejuvenation, for surgical facial rejuvenation, and they want to get rid of the sagging, of the laxity of the neck, the jowls, and rejuvenate the entire face.